joining us for this webinar, where we're going to be discussing everything Mia. I'm here with Melissa.
Hiya.
Who we work very closely, don't we, Melissa? Together, you know, looking after our patients. And we're also here with Ali and Erin. So moving on. So, Melissa, do you want to introduce our team?
Proper introductions then. So obviously Adrian Richards is your surgeon. Ali Arnaut is also your surgeon, who also does the Mia technique. There's myself. And then there's Erin. Erin is our patient. So Erin has had the Mia procedure. So we'll be talking to her in a bit all about her experience and her journey through this.
Yep. Now, we want to tell you a little bit about what Mia is.
Did you know you can enhance your breasts in a quick and gentle way without the need for general anesthesia? Designed for more comfort, faster recovery time and truly natural look and feel, Mia is the ultimate solution for women who have seen their breasts change due to aging, fluctuation in weight, breastfeeding, or who did not see their breasts developed in harmony to their body. Discover a breast harmonization experience with a breakthrough minimally invasive technology designed to be performed without the need for general anesthesia. Thanks to its convenient and gentle approach, you can be back to your everyday life on the same day. Implants used during the Mia experience are the first ever injectable biocompatible implants with a new generation diamond-shaped design, offering greater projection with the same volume. Crafted from super silicones, those implants are flexible, stretchable, and ergonomically designed to move and feel like your natural breasts, giving you natural-looking results in any position, standing, laying down, or moving, with just 3 simple steps. A small incision of approximately 2 centimeters is done and hidden in the fold of an armpit, leaving no scars on your breasts. Once the breast pocket is prepared, our patented balloon tool is inserted to gradually inflate the pocket and gently confirms the space for the implant. Native supporting tissue is preserved and breast sensitivity unaffected, helping with a quicker recovery and higher comfort. With the use of our patented injector tool, the implants are easily inserted into the pocket through the same minimal incision. Placed between the muscle and preserved breast tissue, the results look and feel like part of you. The implant's improved biocompatibility provides better foreign body response, therefore reduce pro-fibrotic complications. Now you can enjoy natural results in harmony to your body and resume your life on the same day. Mia Femtech, setting a new standard in safety, convenience, and true natural results.
Great. So that gives you a bit of an overview into what Mia is. The next really question is, why Mia? And do you want to explain this, Melissa?
Yes, yeah. For a woman to talk about then. So we know that most ladies, so 80% of ladies wear padded bras, but 70% of ladies would actually like an enlargement. But there are lots of things that put you off going that extra step to have it done. And so these are some of the things that you would think about, whether it's safe, what the recovery time is like, and if there's a general anaesthetic.
Brilliant. Was that an issue for you, Erin?
So all of those things on those slides are the exact reasons why I had, put off having a procedure done for so long. I had been thinking and wanting a procedure since, my late teens, really. And, recovery time, wondering how the results would look, and everything in between was the reason why I waited, 15 years really to sort of actually decide to move forward with it.
Oh, brilliant. Thanks, Erin. So now this is something you always explain, Melissa. Do you want to go for it?
What, the chrysalis?
Actually a bit like Melissa, isn't it? Mia.
Oh,
yeah. So what does it stand for?
So minimally invasive, and it's still an augmentation. So we're still using an implant but because the scar is so small and it's done under local anaesthetic, it is minimal.
So what does it actually stand for? The M, the I, and the A, Melissa? Yeah.
Putting me on the spot. Yeah. Well, minimal. So actually, maybe this is a question for Ali. Ali, go on. I'm going to pass this one to you. You're the surgeon.
Yeah, that's fine. So minimal, as in very small. So we're looking at that 2 centimeters scar, 2.5. Invasive, it goes in, but we expand the balloon to move everything away, to move the breast away. And augmentation is enhancing your breast in a harmonizing way.
Thanks. So in summary, Ali, what does it mean?
Minimally invasive augmentation.
Thank you. So we'll move. Next one, please. And, we've got a great solution. So moving on, what we do is we use new technology for a very small incision, local anaesthetic, but we do make you a little bit sleepy, don't we, Melissa?
Yeah, we do, yeah.
Which Erin's going to talk about in a minute. We preserve your tissue. So in the old techniques that I've used for the last 30 years, we've cut tissue, divided nerves and blood vessels. With this new technique, so that was one of the reasons I was so excited about it when we first started, Melissa, is that it uses a balloon to spread and separate the technique, the tissue, rather than cutting any of your tissue. So all your sensation, ligaments, and blood vessels are kept intact. That's tissue preservation. And the next one, please, is the really quick recovery. So we think that patients, Erin's going to talk more about this later, but they get back to work at least twice as quick.
Yeah.
What would you say, Melissa?
Yeah, exactly that. It's very different than recovery.
Yeah, and Erin's going to talk about that in a minute. Next, please. Now we're going to talk a little bit about how it's performed. Can we show that video? Ali, could you explain technically what's going on, please, during the video?
Yeah, so this is the marking tool. On the day of your operation, we come and mark you up in your Mia room, and we put a small incision in the armpit. It's about 2.5 centimeters. And then we use a special device that expands or moves your breast tissue away. So it's not cut, but it's kind of pushed away very gently. And then we use a silicone implant into the special injector that you can see on your screen. And we deploy this special patented diamond-shaped implant that gives you a nice projection, but it's a silicone implant.
And Ali, can you explain what the difference between a Mia diamond implant is and a traditional implant, and why it achieves more for less, volume-wise?
The nice thing about the Mia implant, the difference is the back plate. So the back of the implant is the same as the front. So it looks like a diamond. So it has the curvature in the front and the curvature in the back. So it gives you more projection with less volume. So you're carrying around less heavy implants, but you're gaining a lot more volume and projection. So they look bigger with a smaller.
Thank you, Ali. And now we're going to show you. So Erin was one of the first patients ever to have Mia in the UK. We'll talk about her experience later. But this was Erin on the TV. This is a shortened version. And if you'd like the longer version, we'll send it to you in an email, following email. So here we go.
Most popular cosmetic procedures in the world, but there's now a groundbreaking new way to get a boob job, as the first ever injectable implants have arrived in the UK.
Yeah, taking just 15 minutes and requiring no general anaesthetic, some experts are claiming that the procedure is the future of breast aesthetics. But just how good is it?
Well, we are now joined by Dr. Adrian Richards, one of the first surgeons in the UK to offer the procedure, alongside Erin Alexander, who underwent the surgery just 2 weeks ago. A most popular cosmetic.
So if you'd like the longer version, and then following that, we've been featured in the Tatler, Telegraph. Where else?
And then we're about to be on the Olivia Attwood series as well. So The Price of Perfection, that's coming out in February.
And how was that when we filmed it?
Oh, it was really fun, actually. Yeah, really fun.
Well, tell us a bit more.
I'm not allowed to. You could wait till February.
So we filmed a live procedure with her, didn't we?
We did, yeah.
And she's followed up with the patient, and so look out for that in February. We're not allowed to talk about it. No, okay. Now the other person who we're going to really hand over to now is Melissa and Erin to talk about the procedure, because obviously Erin was one of the first people to have the procedure, and Melissa's been with her all the way through the journey until now. And Erin's also done some really lovely TikTok videos and YouTube videos.
We're going to see one now.
And we're going to see one now.
So I've just had my marking done by my consultant, and actually a Mia specialist consultant came as well. So he done some of the marking and just spoke to me about the procedure. So just about to head down now. I'm back. I've just had my procedure done. I'm feeling good. The actual procedure was fine.
That's just a little clip, but you have done so much for us, and it is honestly so helpful for our patients to watch and just see every moment of your journey.
Yeah, thank you, Erin.
It's so funny watching those videos back now, because I remember that feeling of, you know, the apprehension of going in for the procedure, but then that feeling of coming out and just how excited I was and relieved, and I genuinely felt amazing, not like I just had anything done. So yeah, really funny seeing them now.
Yeah. How long ago was that?
Just 4 months.
Yeah. Does it seem longer or shorter, or?
It feels like a pleasant, distant memory. Like my boobs now just feel like they're just part of me. I can't actually remember my body prior to having them now, which I think just demonstrates, you know, how good the procedure is, because I'm sort of back doing exactly what I was doing. I was back to normal, you know, within a few weeks, and you know, they're just natural for my body. They're not huge. They just, you know, fit with my body shape, and it's amazing. I say, I just feel like I've always had them.
Yeah. Erin, could you just explain a little bit about yourself, you know, your background? I know you've got family, you've got a very busy, demanding job, and a very busy lifestyle. Could you just explain how you felt over the years and how things have changed?
Yeah, of course. So I think I mentioned right at the start, I'd always felt like I didn't have big enough boobs for my body. And I vividly remember, you know, being like 14, 15, 16, like desperately waiting for my boobs to grow, and they sort of never really did. I had always considered having a procedure done, but I was just really worried actually about them, you know, being too big, looking fake. I never really wanted boobs that looked like fake boobs. So I put it off for a long time, and I had previously inquired about having a procedure before I had children, and the advice I was given at the time, which was fair, was to perhaps wait until after I had children, because potentially with the traditional procedure it may impact breastfeeding, and actually your boobs can change through pregnancy and after birth, and they may have actually got bigger. So I waited. I had, you know, those amazing pregnancy boobs and everything like that, and I thought, brilliant, my prayers have been answered, I've got the boobs I've always wanted. And then after I had my children, you know, everything deflated. I was actually like smaller than I was before, and I was never big to start with. So I'd, you know, lost all that volume from the side. I sort of didn't have anything going on straight up and down, but I, you know, was still really apprehensive about having anything done. Obviously I have 2 young children. My children are 3 and 4 now, and I just couldn't account for the downtime. You know, who has 2, 3, 4 weeks where they, you know, can't do anything, can't lift anyone up? And anyone that has young children would know that's an impossible feat. I'm also like really fit and active, and you know, I'd been so used to having the boobs that I had that I wasn't gonna, you know, put everything else on hold to have something that wasn't, you know, a priority potentially. And back in sort of May or June, I, you know, decided that I felt like I wanted to do something for myself. My children are a little bit more independent now, and I thought, you know what, I want to feel, you know, great about myself. They were really starting to get me down. So I sort of just inquired about a traditional procedure, and I spoke to the team, and I spoke to Melissa directly, and I was really clear, and I was trying to articulate myself so everyone knew that I just wanted a result that was natural. I didn't want anything else, and that was my biggest fear. And then Melissa spoke to me about Mia and all of the worries and the fears I had around, you know, scarring, downtime, all of that. You know, it went away because Mia answered all of those concerns I had. And then I decided if it wasn't going to be Mia, it wasn't going to be anything, because I couldn't have, you know, seen what I could have had and then had something else. And I'm so pleased I never had a procedure, you know, before. I would have then potentially regretted it. Yeah.
So that's how we started then, Erin. So you made the decision that Mia was for you. So we have a few sort of stages that we do. So there's our initial contact where we do a DM, isn't there, maybe on Instagram, or you send a message, an inquiry through to us on the website. And then we encourage you to use our 3D software. So our 3D software, you upload your photos. So we offer this service for free. This obviously isn't you, but this is just a mock-up. And it means that you can then see what you would look like with a bit more volume. Now, at the moment, we've got a special Mia simulation where you can do it yourself, and you can see what you would look like with 1 cup size bigger or 2 cup sizes bigger. And then we can also do another image for you, so a more enhanced image to suit you. What did you think about those images when you saw those?
I think being able to do the visualization really gave me the push I needed, because even when I was having the contact with you, I was still worried about how I would look with these boobs, and actually being able to see, you know, the sizes that I could have, you know, looking at, you know, how I look now and looking at those images, there really isn't a huge amount between them. And I think that just shows how clever the software is. It looks now how it did when I used it. And that definitely, it really helped.
Can we keep the video going a little bit?
We can go
and just a thing. So Melissa, can you explain the process of how someone obtains the 3D scan of themselves?
Yeah, so you take some photos of yourself. So we take a straight on and then 2 angles. All the instructions are on the link. So on Instagram, you go and you look at the Crysalix information. And it tells you to do a measurement from nipple to nipple. It's normally about 20 centimeters. And then you just upload your photos, and there it is for you to see.
So you upload your photos, and then
you happens? You can do it yourself.
So you can do your own simulations, or
then we do the enhanced one.
So we can do it.
Looks even better.
We have more tools, so we can do a more enhanced simulation. But do the relatively straightforward one. Experiment, see how you think you might look, and that's a really useful tool, isn't it, Melissa?
Yeah, it's really good
to bring to us to show you, you know, because it helps us understand your aims and goals.
And then the next thing we did after the 3D was booking your appointments. So we'll have a quick look. So we have a new system. It's called Adorial, and this is how you book your appointments. You can see everything on there. It's completely transparent. So all of your notes are on there. All of your photos are on there. So if you suddenly think on a Sunday night, oh, what did they say on that appointment? So you can look it up and you can see, oh, yes, we tried on this size, and it was a demi profile that I liked. How did you find that? Was that easy for you?
Play the video. Yep.
It made the process a lot smoother.
We just got a quick demo of it, Erin, and then perhaps you could tell us how you found it. You have your records are all available to you, so at any stage you can see your records, you can see your photographs, you can see everything. You can make your own. Melissa, you're better.
Yeah, well, most people do look at things on their phone, so it's just handy. You don't have to. You can just do the app, and it's all just there for you. It's easy. Do you agree, Erin? Is it easy?
Yeah, absolutely. So in the moment of consultation, you know, there's information overload, you're excited, there's so much going on, and actually a lot of the key useful information and important information you gave me, as soon as I left, I sort of forgot it all. So actually, once I've gone home and settled down and got over the excitement of everything that I just did, I was able to refer back to all the things that we spoke about, the sizes, as you say, and then I was actually able to go through and just look at the information as well. It's really easy to use, and it just breaks down that barrier to entry. Like everything is just there, and you're able to just find it and access it.
So you like the Adorial because it's designed for the patient, it's designed for your ease, so it makes everything easier and more transparent.
Yeah, so once you've done that and you've booked your appointment, so all the appointments are there for you to see online, then you come in for your sizing appointment, and that's when we try on all our different sizes. We have them on the table here, don't we? So sizes 1 to 4. their external size, I don't know whether you can see this, and it's like a teardrop shape. So they go all the way up to size 4, but it's not going huge, is it, Erin? So it is 1 to 2 cup size of an increase. Now, in the picture here, you actually brought your bikini with you. You are the only person that's done that so far, but it was such a good idea. Tell us about it.
So I came to my appointment, I was trying on the sizes in my top, and I instantly was like, oh my goodness, my boobs are so big. And it takes you a little while to get used to having the implants in, and then very quickly you adapt. But part of my thing is I wanted to see how I would feel with, the size of my boobs in, outside of clothes. And the only way to do that was to use like my bikini, which I've, worn before, and I know how I feel in it. So I was putting the sizes in the bikini and trying to take photos. And again, like the photos I took in that sizing appointment where I had those implants in, they again look so similar to my results look now, as you can see in that photo. And it's a really great way of visualizing how you'd look. I took those photos away, I was showing them to people because I came to my appointment alone. I was showing them to my husband, I was showing them to my mum, kept referring back to it, really to just like make sure I was comfortable with it. But the sizing appointment just gives you the opportunity to explore different shirt sizes. I think people think that they want, a certain size, and those are the sort of questions that I get asked a lot on my channel is, why 170? Did you not want to go bigger? What about this? And really it's just finding the size that is right for you and your body shape, and that's going to help you achieve the results that you want. So it is very personal.
Yes. So what we find is the combination of 3D simulation combined. So these are not Mia implants, but they're simulators. So they come from size 1. They get bigger to, you've got the other ones.
4, yeah.
Yeah, and 4.
In your bra, or in a top, and they just sit like this, and it just helps you.
So explain, when someone comes in, Melissa, how do you advise them on what implant to choose by using the sizes?
So we do the measurements with you. So we know what's going to fit their body, and suit their frame. And then it is literally a case of trying them on. And you only know when you try it on and you go, oh no, that's way too big, or oh, that's too small, let's go up a size. And it is a fun appointment, isn't it, Erin, that when we do that?
It's exciting. It's very rare you get to go somewhere and try on lots of different boobs. But no, it's really exciting, and it really builds that excitement and all of that around it.
And a question we also get, so we have a lot of ladies that aren't sure whether they want Mia or whether they want a traditional implant. And if you come for the appointment, we have all the implants. So if you find that maybe the size of number 4 for Mia isn't enough for you, then we just go into the traditional implants and we can try those on too.
So Mia's are currently limited to size, so we're going 1 to 2 cup sizes bigger, very natural but noticeable. But we don't, they're very chic, petite in sort of proportion.
I've just seen a question that has come through, so we can see, as we're talking about sizes, what size is available compared to the normal procedure, so the traditional.
You explain that one.
So the biggest size in Mia is a 195 if we're in a demi profile, and that's about equivalent to a 240 cc's in traditional. So it's really that you can sort of get the look of a 240 with Mia. So that is your sort of 2 cup sizes bigger, isn't it?
Yeah.
And then if you want bigger than 2 cup sizes,
Ali, as our technical expert, thanks, Melissa. What would you say?
Yeah, I would agree. I think it's really a personal choice anyway at the end of the day, but coming in with the sizers, testing them out, seeing what fits your body shape, and then it comes up to you as the patient, I think, what you feel harmonizes your body and what fits in your shape.
Yeah, and we're going to show you some before and after pictures of Mia patients in a minute, so we'll show you that.
So this is what everybody wants to know, Erin. We want to know, how was it actually on the day? What sort of time did you come in? How long did you stay with us? What was it like? Did you get given anything nice on the day? That sort of thing. Go for it.
Yeah, so I came into the clinic around 8, and I was greeted by the most beautiful Mia package in my room. And I knew that Mia wasn't experienced, but it really wasn't quite what I was expecting. A beautiful gift box, a lovely little purple fluffy rug on my bed. You know, I got my beautiful Mia necklace as well, and a few other goodies, which again really just set the tone for the experience and the sort of day I was going to have. You know, I wasn't really nervous or apprehensive about the procedure anyway, but that definitely like settled me down. I was really more excited than anything. I just couldn't wait to get started. You're testing me now for times, but not too long after that, Melissa, you came in first, and we had a conversation. I think we spoke about sizes and just checked everything was okay, and then Adrian came in, and that's when we sort of done the sizing. We really spoke at length again about sizes, all the markings. My husband came with me, and actually it was a really comprehensive session, you know, answering questions not only from me but of my husband, because, you know, it's not just about you in that moment, everybody sort of involved and impacted. So we went through that. Then I had all my markings done, as you saw in that TikTok before. That was just after that. And then about half an hour after that, I totted down to surgery. And again, I was just so excited. I had the anaesthetic and everything, but I wasn't asleep, totally awake through it all, chattering away, talking a whole bunch of gibberish.
Yeah, we learned your life story, Erin. Yeah.
Probably, which is the best bit, because I actually, I remember it. I like vividly remember it, having the conversations and all of the team like being really caring and, you know, making sure I was okay. I didn't feel a thing, but I could feel, you know, a little bit of tugging or moving going on if you've had a cesarean or anything like that. That sort of like tugging, but no pain at all. And then I remember being able to have a quick peek at my boobs before I got the support bra on, and that honestly is just something I won't forget. They just looked amazing straight away, and in that moment I just knew that they were perfect for me. And then I went up to recovery, and I was there for maybe half an hour or so, and then I went back up to my room, and then I was probably only there for a couple of hours, and then I left. But at that point I did start to like get some swelling and things like that, but I'd been given, you know, all the medication, all the pain relief that I would need, and, you know, I went back on my way and I went home and I felt great. Yeah, like no problems at all.
Yeah. So we've just had another question come in. So you said that you were with your husband at the time. So somebody has just asked, an anonymous person actually, do they need to be accompanied by somebody when they leave? Ali, do you want to answer that one?
Yep.
The recommendation is always to have someone with you after a procedure, whether it's on the local anesthetic or general anesthetic, just to take you home. You know, you've had a bit of sedation, so it's always nice to involve, you know, your family, your friends in your day anyway, and they can look after you for the first 24 hours.
So what we're really trying to do is make it as pleasant an experience as an operation can be. So we're in a beautiful location in Fitzroy Square, where you have your own room overlooking the square. Your family can stay in it. You know, we've got all the things that Melissa, you provide. You know, so it's a nice experience. You'll see myself, the anaesthetist. You have your procedure. Your family can be there all the way with you. But it is important, obviously, that you go home and you're looked after.
Yeah, and everything happens in the same building, doesn't it, Erin? Yep. So your pre-op assessment, that's 1 to 2 weeks before your procedure, and then your procedure. And can you tell us about your post-op appointment at 1 week? How do we do that?
We done that online, I think, didn't we?
Did.
Yeah,
so it was a real account. Yeah, you didn't need to come in.
No, it was really easy. And again, like, you know, all the use of technology just makes it a much more pleasant experience. You know, I don't live in London personally, so actually being able to do things online just really helps and just makes the whole journey, you know, far more enjoyable and far less stressful. So, you know, we had a conversation, you know, you had a look at my incisions, how they were going, and just asked how I was feeling, and the team were checking in with me, you know, through the course of that first week anyway, just making sure that I was fine. So yeah, really, really pleasant experience.
And how does your scar look
now?
I was gonna say, do you want me to get it out? Do you want me to
go on.
I don't know how good it'll be on the camera, but so this is for...
Can you see that?
4 months. Well, the fact that you probably can't see it is probably a good thing. You can see it just very, very slightly there. And then on this side, this one is a little bit redder, but that one always has been. But on this side, it's barely visible at all now. And I went on holiday recently, and I had no concerns at all that anybody was going to be looking at me thinking I'd had something done. And I, you know, had this new level of confidence that I just hadn't experienced before. It was amazing. Just shows how much something, you know, potentially a small thing for some people can make such a big impact on your life.
A question we get asked when it comes to the armpits is all about washing, deodorant, and what do you do? So you tell her, and shaving, what did you actually do?
So I didn't. What did I do? So I didn't shower for a few days. I was just having like low baths and just like washing with like flannel and stuff like that. And then I was having a proper shower, but avoiding the area and just washing it again with a flannel and like no like fragrance soap and things like that. I didn't shave the area for 10 days or so, which wasn't amazing. Maybe just around the edges to tidy up a bit, but nowhere near the scar. I didn't use aerosol deodorant. I was just using after the first 4 or 5 days, I was just using a little bit of gentle sensitive roll-on just on the area around the scar, bearing in mind I had my procedure in the height of summer as well. So I was contenting with that. But you know, after a week or so, I was sort of going about things as normal.
Brilliant. So we've got lots of questions. So does this procedure affect the ability to breastfeed, Erin?
Oh, I don't know. That one's probably for you.
So I know, but Ali, we're just going to roll.
It doesn't affect the ability to breastfeed, because the implants actually sit underneath your breast tissue. So your breast tissue is moved forwards, and the implant sits underneath it. So you're absolutely fine to breastfeed.
So all your breastfeeding ducts and is preserved. It doesn't. Next one. Why don't traditional implants come in diamond shapes, Ali?
I don't think we have the technology to go a lot bigger at the minute. Maybe we never know when, but at the minute, the diamond shaped are restricted in size for Mia.
This one's for Erin. So it's about exercise.
This is from Becky. Thank you, Becky.
So Becky has asked us, when can she exercise?
So this was a big consideration for me. I said it at the start. So I was going out for a gentle walk the next day, you know, just taking it easy. You're quite like bloated and full of fluid after the procedure as well. So I actually found just doing some gentle walking really helped with that. And that wasn't something I expected. And then I was doing some gentle lower body exercising within, 3 days. I have a static bike at home. So I was just really gently doing that. And then I was back to doing a little bit more like typical exercising within a week, but I wasn't doing upper body. Not because it was like painful or anything. I just wanted to avoid it. I was like struggling to lift my arms a little bit like that, just where everything was a bit tight. And I was just being mindful that I didn't want to, create any stretching unnecessarily. I was really being careful of like the incision site, because I knew anything that I did, during those first few weeks might affect the healing. So that was the main reason I wasn't doing stuff, not because I couldn't. And then I was back to, doing like upper body exercises within, 2.5 weeks or so. And that was probably like in line with what I had always been doing. I'm very fit and I exercise a lot. So, that was definitely a consideration. So it didn't have a huge impact, and you can absolutely get back to exercising as long as you are mindful and you just go with your body. If you don't exercise a lot before the procedure, then I wouldn't jump straight back into exercising. But if you're, fit and healthy and that is part of your routine, then and you're feeling great, then go for it. Just be careful.
And what about work? So someone's asked us about returning to work. So when did you actually feel like you could do it? Even if you're working from home, when did you feel like you were almost back to yourself?
Yeah, so I had my procedure on the Tuesday. I took the Wednesday off, and then I was back working from home on the Thursday. And then I did do a short drive on that Thursday as well. So I was, feeling able to drive a short distance. And then I travelled as normal to my workplace the following Tuesday. So I was driving normal and returning back to the office within a week, but I was working, 2 days after I had the procedure, and it was fine.
Yeah, that's amazing.
We've got a quick question here for Ali, I think. Thanks, Aaron. That was great. Is this procedure able to work for those with dipped in, less fatty armpits?
Yeah, I think that the problem, your armpit fatness, let's say, isn't going to affect how we do it. We just use a small cut there, and then we go from there into the breast tissue. So as long as you've got the right shape for it and they're suitable after receiving our consultation, we can absolutely do it.
Okay. Now this is a really important one. So thanks for this one. Can there be complications afterwards with this procedure? That's what scares me. So I think this is really important. So at the end of the day, it is an operation. We make it as safe as possible, but an implant is inserted under your breast tissue via a very small incision. It's really just that we use new technology to insert the most technologically advanced implant, but it is still an implant. And the implant is made by a company called Motiva, which is the most innovative and biggest implant company in the world. It's recently got FDA approval. And Ali, could you just tell people a little about the implants?
So I think the Motiva implants and Mia, they have a nice little coating on them that allows them to be biocompatible. So they kind of harmonize themselves with your body, so they don't produce a lot of reaction per se. But the nice thing about them as well is they're very stretchable. So one of the questions I was reading is about the trauma or if you get knocked, etc. They're very stretchable, so they do handle a bit of that. But obviously, because they're still implants, if you have a significant trauma to them, there's a risk to the implant. But we've not had any issues with that.
Yeah, so and essentially, Melissa, we've been using these implants for how long?
6 years.
Why do we like them?
Because they look so natural. They are very, very soft. Traditional Motiva implants are round, but they naturally go into that teardrop shape.
Why else do we like them?
No capsules.
What do you explain what that means?
So when your implant, one of the complications of having a breast augmentation is that you might get capsular contracture, and that is when the implant goes hard.
Which when your body makes it, so your body always makes a lining around the implant, and in some cases it's like a swim hat that can constrict and make your breast painful and hard. But how many years we've been using Motiva implants?
6. How
many capsules have we had?
None.
None
on first case.
No, and how many cases is that?
Hundreds.
Hundreds. So we love them because the covering doesn't cause any inflammation. So the risk of BII, ALCL, and them going hard is very small. But these are just the most modern design of these implants.
So other questions that we get asked, and we've got quite a few questions that have come in from Instagram as well, is that do you need to change them every 10 years? Like that's what they always used to say. Do you change implants every 10 years, Ali?
No, I think that's a historical kind of fact about implants, but implants are forever. Unless there's an issue with them, there's no need to change them. So we do keep an eye on you. We kind of, suggest maybe a scan at 10, 12 years. But they can be with you forever unless there's an issue.
Yeah, and what we have now, we have the ability to scan you. So we would like to see you every 2 years, and we will scan your breast with our ultrasound machine. Ali's an expert scanner, and so we'll be able to look inside. The other thing is we can also be able to scan and check the integrity of your implant. So yes, we do like to follow you up, but it's not normally the implants that change. It's your body that changes around the implant.
So putting on weight, losing weight, doing training for a marathon, having babies, breastfeeding, all of those things change. And the question that we're asked a lot now is about if the implant goes in through the armpit incision, what happens if it needs to be taken out? Say, let's say 12 to 15 years, if you need to have it removed, how would it be removed?
Ali?
So if it does need to be removed, we might need to do a separate cut and take it out, but we've not had that issue so far.
Essentially, this is new. This is groundbreaking technology. It's like when laparoscopic surgery, telescopic surgery came to general surgery. You don't have your appendix taken out now by a big cut. This is plastic surgery's equivalent. So the technology that Motiva and Mia are making, Ali, is really improving, isn't it? It's groundbreaking technology, and we now have the ability to have a reversal tool which we can remove the implant. So the technology is getting better and better. And Melissa, and Erin, if anyone's thinking of breast augmentation, why should they think about Mia? I'm going to ask you first, and then Erin.
So for me, I think the most amazing thing is that there are no scars on the breast. And I still can't get over it when we see people at their 1 week post-op appointment and they show us their armpits and there's no scar here.
Yeah.
I think that's amazing, because when you watch things, you know, like Love Island, when you watch things like Love Island and you see people with bikinis and you see their scars, that's not there. Nobody notices this in there. I think that's amazing. And it's the recovery that it's so different to having a traditional augmentation. Erin, do you agree? Or you got different?
Absolutely. Your point about the scars underneath the breast, that was a big consideration for me. And, you know, now I look in the mirror and I'm, you know, standing there with no clothes on, and there is no indication on my body that I can see, like initially, that would suggest that I've had anything done, you know, that just makes it way more natural. And, you know, I just feel like in time, I'll just forget I had anything done at all, because visually there just isn't anything to see. And that's what makes it so amazing, you know, teamed with the recovery, the gentle procedure, all of that just makes it such a perfect option for people that were, you know, worried about a traditional procedure for all of those other reasons.
Great. And so guys, I know we could talk all day, couldn't we?
Yeah,
so
you just had this question.
So we've got 4 minutes left. So
we've just had a question asking for before and after photos with no clothes on. So here we go. We've got a couple of examples. We have lots more when you come into clinic as well. Obviously, a lot of people are quite shy when it comes to social media, but we have lots that you can see.
Can you explain what the photo shows?
So all the photos on the top are the before and after. There we go.
How long after?
That is at 6 weeks. We take all of our photos at 6 weeks. So you will see that at 6 weeks, you've got a little bit more changing to do. Yeah. They get better and better, actually. Up to a year, they probably...
They soften the top. If you can see the lady on the bottom, you see the slightly concave, that will flatten slightly in the following months.
Scoop out a little bit and more volume, and they might even
and become more natural,
closer together. So these are all different sizes, and when you come into clinic, we've got lots of different photos.
So which implant was this one?
This was around the 170.
Okay.
The one before was a 195.
So
both demi-profiles.
Both demi-profiles, both patients taken 6 weeks following surgery.
Absolutely.
And would expect them to get better and better with time.
Absolutely, yeah.
Great. So we've got now 3 minutes. Melissa, you take this on.
We've done quite a few of our questions, actually. We're doing quite well. Maybe this question here, does having implants affect mammograms?
Ali?
Yeah, I'll take that one. No, it doesn't. When you become eligible for screening, when you go to your first mammogram, you can just tell your radiographer that you've got implants, and they just do slight adjustments in the screening program, but you get the same images and everything. So it's absolutely fine for you to have mammograms.
Right, Nally, I know you're a breast surgeon. You do a lot of people, you know, oncology work. What age does mammogram screening start?
So you get invited to the national program at the age of 50 up until 70. And then you can have mammograms from the age of 40, but that's not part of the screening program. That's only if you are symptomatic.
Yeah, brilliant. Okay, any more questions?
I've just got another one. So how long do you wear the surgery bra for? So it's 3 weeks rather than the 6 weeks. It is 3 weeks. So day and night for 6 weeks, you'll be wearing that surgery bra. We give you 2 bras, so you've got an option to choose your favorite one. Basically, there are what did you think of the bras we gave you? They're both made by lipoelastic, aren't they, Erin?
Yeah, they were brilliant, and they all featured in my videos as well. So we had the black one, which went on straight after surgery, and then I had the compression band as well, which I found actually really comfortable and really supportive, and really just helped, you know, reduce some of that pressure and, you know, hold them down a little bit. And then after, you know, the first 4 or 5 days, I transitioned to the white version of the bra again in some of my videos, like really comfortable. And again, like really subtle. I could wear them under clothes and I didn't feel like I was like restricted in things that I was wearing. So like a really nice, like modern approach to bras. I've just seen a question come in that I really want to answer. And it is something I did answer on my channel as well, because I was getting lots of questions about it. With like, can you feel the implants inside? generally, as I'm moving around my day to day, I cannot feel them. They don't feel, you know, necessarily heavy or anything like that. I don't have a huge amount to compare to because I didn't have big boobs before, but I guess, you know, I think they feel how they would feel if you sort of had boobs anyway. Like there's movement to them. If I like move around, they like wibble and jiggle a little bit, which, you know, is great. And the only time I can ever really feel an implant is if I put like a little bit of pressure on them from the side or from the front, and that's where I almost get like a sensation inside, but it's not painful, it's not uncomfortable, I'm just aware of it. So generally I can't feel them. And the other question I get asked all the time, I really want to answer here, is like, are they do they feel natural? Are they soft? Are they squishy? And absolutely they are. And I really tried to show this in one of my videos I posted a couple of weeks ago, so please watch that if you haven't, because I know this is a really big concern of people. Is mine are so squishy. I don't know if you can see that, but there is like no resistance at all. When I'm pushing. They feel like as if I was squeezing my arm or something like that. So they're not hard, they don't feel like a ball, it literally just feels like a squishy baby's bum or something like that. So please don't let that be something that puts you off, is worrying that again that they're going to feel like a hard ball inside. They absolutely don't. And after the first, you know, 4-6 weeks, they really do change. As much as I was so excited about having it done, the first time I took off that support bar and looked at them, I had the whole, oh my goodness moment. And Melissa warned me that that is so normal and everyone gets that. One, because you're not used to it, and two, they're really swollen. But after the first, you know, 4 weeks or so, they really did like settle. One settled a little bit faster than the other, but I reached out to Adrian, he told me that was absolutely totally normal. And 6 weeks, I stopped even thinking about them looking like a bit high or whatever. Like they absolutely just dropped into a natural shape, and now I have like a very natural flick, quite weighty at the bottom, but they wouldn't look sort of anything other than natural if you didn't know I had something done, if that makes sense.
Brilliant. Well, thanks, Erin. So I'd just like to say we've run out of time, so we'll probably have to do another one of these again, because we've got so many questions.
But Erin's you've got your TikTok account.
Yeah.
And what else? You've got two, have you?
Yeah, so I've got my TikTok, which I'm sharing stuff sort of frequently, and I documented my whole journey every day for the first month or so. And my YouTube is where I done, you know, some longer form videos leading up to procedure, the first like week after the procedure, 6 weeks after the procedure. We had some conversations with Adrian as well, and both handles are Erin Louise Ruth. So there was a question about that in there as well, so you're more than welcome to share that with everyone on the chat.
You're happy to answer questions, yes?
I'm always happy to answer questions. I'm so passionate about it, and I really hope that other people can benefit and feel how I do now. And I really has been such a positive experience for me, and so much has changed in my life in terms of like confidence, how I hold myself, how I just feel, you know, my relationship, loads of stuff like that, you know, and lots of people don't think that all of those things will happen out of having a procedure like this done, but it really is amazing.
Erin, thank you very much. You said that really nicely. Thank you. Ali, thank you very much for joining.
Thank you very much for having me.
Ali's a very talented young surgeon, and you know we're really pleased to have Ali in the team. I'd like to say thank you to a couple of other people. I'd like to say a big thank you to Susan. So I'd like to say thank you to the Aurora team. We built up a business years ago called Aurora. Many people have come back. Yourself, Susan Morrow, who does a great job answering inquiries.
She answers all inquiries.
She's great. Sinead, our nurse, you know.
Yeah, Sinead Buckland is our nurse. She's amazing.
You know, lovely. We've got Arena, who runs our finance. We've got Jim, who's you know, come back, and our operations executive. So the whole team have come back.
Abby.
And Abby.
So Abby will be in consultation.
And Sinead and Sophie. So I'd like to say big thank you now to two people who've helped put this together. So one is a new member of our team. He's going to come up now, and we're going to give. What are we going to give her?
So this is the little Mia diamond necklace that you get.
Yeah.
There we go. So part of the experience, and we're all wearing it. And Erin, you're wearing yours as well.
So Lucinda, come up. Just Lucinda. So Abby is our new. What do you do, Abby?
I'm patient experience manager. So anybody who's coming in for consultations will see me soon, hopefully.
Yep. And Lucinda put all this webinar together at really short notice. So we'd just like to say thank you very much for listening there. And here is what?
Your Mia necklace.
Your Mia necklace. So thank you very much. Thanks for joining us, guys.
Yeah, so most importantly, our lines will be open. So if you want to phone up and speak to somebody, or you can book online, you can see all of our appointments that are coming up. The 2nd, the 3rd, the 13th, we've got some spaces. We've had the whole